We truly believe that federal investment in research works. The tried and true NIH model also works, and we're going to hear about how NIH funding drives discovery and therapeutics from our panelists.
Without basic medical research, a lot of the advances that we all celebrate today would not be possible. NIH funding is absolutely essential. What troubles me about the climate in Washington right now is I don't sense the urgency that I think is absolutely necessary if we're going to see not only the budgets protected but expanded. Quite frankly, we should be talking about expanding the amount we spend on medical research, and I can't quite figure out why, because I think everybody has benefited from NIH's research in one way or another, whether we realize it or not.
To actually affect change, it takes people like yourselves to go out and, when you're mowing the lawn and your neighbors next door to try and engage them, trying to tell them about what NIH is doing and why it's important. There are a lot of people who are suffering with tragic diseases out there. Some of them are rare diseases, and they're tough diseases to get at. All the patients with Huntington's that I took care of are dead. That message that these diseases are really, really bad is, I think, the main thing that motivates research.
I was an undergraduate at MIT in 1975 when David Baltimore was awarded the Nobel Prize. 7 years later, I was on the wards, and at that point in time, we started to see a lot of kids with AIDS. Very quickly thereafter, the field was able to very rapidly identify human immunodeficiency virus as the cause of AIDS, and understanding of the viral life cycle allowed NIH funded research to occur that then began to develop therapies. Fast forward 30 years after the first description of HIV in kids, the number of new infections around the world has gone from 500,000 to about 250,000 per year. And in the United States, new HIV infection of babies are virtually unheard of. We're now at the point where most medical students or individuals who complete pediatric training will never see a case of pediatric HIV infection. And I think we have a number of people to thank for this, but I think the NIH has really been the foundation and a real organizing force.